Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental condition that affects millions of people worldwide. But how does ADHD actually develop and change over time? In this video, we'll explore the journey of ADHD from childhood through adulthood, highlighting the key stages, symptoms, and factors that influence its progression. Whether you're someone living with ADHD, a parent, or simply curious, understanding this timeline can offer valuable insights and support. Let's begin by looking at how ADHD typically presents in early childhood and what signs might first appear. ADHD symptoms often start to become noticeable in early childhood, sometimes as young as age 3 or 4. Parents and caregivers might observe behaviors such as excessive fidgeting, difficulty sitting still, impulsive actions, and trouble focusing on tasks or play. These early signs can sometimes be mistaken for normal childhood energy, but when they persist and interfere with daily life, they may indicate ADHD. Early identification is important, as it can lead to timely support and intervention, helping children develop coping strategies from a young age. Diagnosing ADHD in childhood involves careful observation and assessment by healthcare professionals. Teachers and parents often play a key role in recognizing patterns of inattention, hyperactivity, and impulsivity that are more pronounced than in other children of the same age. Standardized questionnaires, interviews, and behavioral checklists are commonly used tools. Early diagnosis can make a significant difference, allowing for tailored interventions and support at home and in school, which can improve outcomes for children with ADHD. As children with ADHD enter school, their symptoms often become more apparent. The structured environment of a classroom can highlight difficulties with attention, following instructions, and completing assignments. Children may struggle with organization, forget homework, or have trouble sitting still during lessons. These challenges can affect academic performance and social relationships, sometimes leading to frustration or low self-esteem. Support from teachers, individualized education plans, and behavioral strategies can help children navigate these hurdles. ADHD can also influence a child's social development. Impulsivity and difficulty reading social cues may lead to misunderstandings with peers. Some children with ADHD may interrupt conversations, struggle to wait their turn, or act without considering consequences, which can affect friendships. Social skills training and supportive environments can help children build positive relationships and develop better communication skills, fostering a sense of belonging and confidence. During adolescence, the symptoms of ADHD can shift. While hyperactivity may decrease, difficulties with attention, organization, and impulsivity often persist. Teenagers with ADHD may face new challenges, such as managing increased academic demands, navigating complex social situations, and making decisions about their future. Emotional regulation can also be more difficult, sometimes leading to mood swings or frustration. Support from family, teachers, and mental health professionals remains crucial during this transitional period. High school brings increased academic responsibilities, and for teens with ADHD, this can be particularly challenging. Managing multiple assignments, meeting deadlines, and preparing for exams require strong organizational skills, which may be an area of difficulty. Teens might also struggle with time management and prioritizing tasks. Academic support, such as tutoring, accommodations, and executive function coaching, can help students with ADHD succeed and reduce stress during these demanding years. Emotional regulation can be a significant challenge for teenagers with ADHD. They may experience intense emotions, frustration, or mood swings, which can impact relationships with family and peers. Learning coping strategies, practicing mindfulness, and seeking support from counselors or therapists can help teens manage their emotions more effectively. Building emotional resilience is an important part of navigating adolescence with ADHD. Adolescents with ADHD are at a higher risk for engaging in impulsive or risky behaviors, such as experimenting with substances, reckless driving, or breaking rules. Impulsivity and a desire for stimulation can contribute to these tendencies. Open communication, clear boundaries, and supportive guidance from adults can help teens make safer choices and reduce the likelihood of negative outcomes. The transition from adolescence to adulthood is a critical period for individuals with ADHD. As they move toward greater independence, young adults face new responsibilities, such as managing finances, pursuing higher education, or starting a career. The challenges of organization, time management, and self-motivation can become more pronounced. Support systems, including coaching, therapy, and peer networks, can help young adults navigate this transition successfully. College life introduces a new set of challenges for students with ADHD. The need to manage schedules, meet deadlines, and balance academic and social commitments can be overwhelming. Many students benefit from academic accommodations, such as extended test time or note-taking assistance. Campus counseling centers and ADHD support groups can also provide valuable resources, helping students develop effective study habits and coping mechanisms. Entering the workforce brings its own set of challenges for adults with ADHD. Difficulties with organization, time management, and maintaining focus can impact job performance. Some adults may struggle with meeting deadlines, remembering tasks, or managing workplace relationships. However, many find success by leveraging their strengths, seeking reasonable accommodations, and using tools like planners or digital reminders to stay organized. ADHD can also affect adult relationships, including friendships, romantic partnerships, and family dynamics. Adults with ADHD may struggle with communication, forget important dates, or act impulsively, which can sometimes lead to misunderstandings or conflict. Open communication, mutual understanding, and seeking couples or family therapy can help build stronger, more supportive relationships. Living with ADHD can impact self-esteem at any age. Repeated struggles with attention, organization, or impulse control may lead to feelings of frustration or inadequacy. It's important for individuals with ADHD to recognize their strengths and achievements and to seek support when needed. Positive reinforcement, therapy, and supportive communities can help boost self-confidence and resilience. While some individuals may see a reduction in certain ADHD symptoms as they age, many continue to experience challenges throughout adulthood. Inattention, distractibility, and difficulties with organization often persist, even if hyperactivity decreases. Understanding that ADHD is a lifelong condition for many can help individuals and their support networks set realistic expectations and develop effective coping strategies. Some people are not diagnosed with ADHD until adulthood. They may have developed coping mechanisms that masked symptoms, or their challenges may have been attributed to other causes. A late diagnosis can bring relief and a better understanding of lifelong struggles. It also opens the door to new strategies and supports that can improve quality of life moving forward. ADHD often co-occurs with other conditions, such as anxiety, depression, or learning disabilities. These comorbidities can complicate diagnosis and treatment and may require a comprehensive approach to care. Addressing all aspects of an individual's mental health is essential for effective management and improved well-being. ADHD can present differently in males and females. Boys are more likely to be diagnosed in childhood, often due to more noticeable hyperactive or impulsive behaviors. Girls may display more inattentive symptoms, which can be overlooked or misattributed. Understanding these differences is important for accurate diagnosis and support for all individuals with ADHD. ADHD development is influenced by both genetic and environmental factors. Family history plays a significant role, as ADHD tends to run in families. Environmental influences, such as prenatal exposure to toxins, premature birth, or early childhood adversity, can also contribute. Understanding these factors helps researchers and clinicians develop better prevention and intervention strategies. Research shows that ADHD is linked to differences in brain structure and function, particularly in areas related to attention, impulse control, and executive function. These differences can affect how individuals process information, regulate emotions, and respond to stimuli. Advances in neuroimaging have deepened our understanding of the biological basis of ADHD, paving the way for more targeted treatments. Executive function refers to a set of mental skills that include working memory, flexible thinking, and self-control. Many people with ADHD experience deficits in these areas, which can make planning, organizing, and completing tasks more difficult. Understanding executive function challenges is key to developing effective strategies for managing daily life with ADHD. ADHD treatment often involves a combination of approaches, including behavioral therapy, medication, educational support, and lifestyle changes. The specific strategies may change over time, depending on the individual's age, needs, and circumstances. Regular follow-up with healthcare providers ensures that treatment remains effective and is adjusted as necessary. Behavioral interventions are a cornerstone of ADHD management, especially in children. These may include parent training, classroom strategies, and positive reinforcement techniques. By teaching new skills and reinforcing desired behaviors, these interventions can help reduce symptoms and improve functioning at home and school. Medications, such as stimulants and non-stimulants, are commonly prescribed to help manage ADHD symptoms. These medications can improve attention, reduce impulsivity, and decrease hyperactivity. It's important for individuals and families to work closely with healthcare providers to monitor effectiveness and manage any side effects, ensuring the best possible outcomes. Educational support is vital for students with ADHD. Individualized education programs, IEPs, 504 plans, and classroom accommodations can help level the playing field. These supports may include extra time on tests, preferential seating, or assistance with organization. Collaboration between families, teachers, and school counselors is key to ensuring students receive the help they need. Developing healthy lifestyle habits and coping skills can make a big difference for people with ADHD. Regular exercise, a balanced diet, and good sleep hygiene support brain health and emotional regulation. Learning time management, organization, and stress reduction techniques can also help individuals manage daily challenges more effectively. Technology can be both a challenge and a helpful tool for people with ADHD. While distractions from devices can make focus difficult, digital tools like reminders, calendars, and organizational apps can support daily functioning. Finding the right balance and using technology intentionally can enhance productivity and reduce overwhelm. Family support plays a crucial role in the development and management of ADHD. Understanding, patience, and open communication can help reduce stress and improve outcomes for everyone involved. Family therapy, support groups, and educational resources can empower families to work together and advocate for their loved ones. Connecting with peers who share similar experiences can be incredibly valuable for individuals with ADHD. Support groups, online communities, and mentorship programs offer opportunities to share strategies, celebrate successes, and find encouragement. Community support helps reduce feelings of isolation and fosters a sense of belonging. Many people with ADHD possess unique strengths, such as creativity, problem-solving skills, and the ability to think outside the box. Embracing these strengths can help individuals find fulfillment and success in various areas of life. Encouraging creative pursuits and recognizing diverse talents can boost self-esteem and motivation. Despite the challenges, many individuals with ADHD demonstrate remarkable resilience and adaptability. Over time, they may develop effective coping strategies, build supportive networks, and achieve personal and professional goals. Focusing on growth and progress, rather than just symptoms, can lead to a more positive outlook and greater satisfaction in life. Cultural attitudes and beliefs can influence how ADHD is perceived and managed. In some cultures, symptoms may be misunderstood or stigmatized, leading to delays in diagnosis or treatment. Raising awareness and promoting understanding across diverse communities is essential for ensuring that everyone has access to appropriate support and care. Stigma and misconceptions about ADHD can create barriers to diagnosis, treatment, and support. Some people may believe that ADHD is simply a lack of discipline or motivation, rather than a legitimate neurodevelopmental condition. Combating stigma through education and advocacy is crucial for promoting acceptance and understanding. ADHD does not disappear with age, and older adults may continue to experience symptoms. However, they may also develop effective coping mechanisms and routines that help manage daily life. Recognizing and addressing ADHD in older adults is important, as it can impact memory, organization, and overall quality of life. Long-term outcomes for people with ADHD vary widely. With appropriate support, many individuals lead successful, fulfilling lives. However, untreated ADHD can increase the risk of academic, occupational, and social difficulties. Early intervention, ongoing support, and a strengths-based approach are key to positive long-term outcomes. Ongoing research continues to expand our understanding of ADHD. Scientists are exploring new treatments, early identification methods, and the genetic and environmental factors that contribute to the condition. Advances in neuroscience and technology hold promise for more personalized and effective interventions in the future. Advocacy organizations play a vital role in raising awareness about ADHD, supporting research, and promoting policies that improve access to care. By sharing stories, providing resources, and fighting for rights, advocates help create a more inclusive and supportive society for people with ADHD. A strong support network is essential for individuals with ADHD at every stage of life. This network may include family, friends, educators, healthcare providers, and peers. Building connections and seeking help when needed can make a significant difference in managing symptoms and achieving personal goals. Hearing personal stories from individuals with ADHD can provide hope, inspiration, and practical advice. Each journey is unique, and sharing experiences helps break down stigma and build understanding. Whether facing challenges or celebrating successes, these stories remind us that no one is alone in their journey with ADHD. Many successful individuals have ADHD, and their stories highlight the importance of embracing strengths and seeking support. With the right resources and mindset, people with ADHD can excel in diverse fields, from the arts to business and beyond. Celebrating these achievements helps shift the narrative from challenges to possibilities. To summarize, ADHD is a complex, lifelong condition that develops and changes over time. From early childhood through adulthood, individuals may experience a range of symptoms and challenges, but also opportunities for growth and success. Early identification, ongoing support, and focus on strengths are key to navigating the journey with ADHD. The key takeaways from this exploration of ADHD development are clear. Symptoms can change over time, support and understanding are crucial, and everyone's journey is unique. By staying informed and advocating for yourself or your loved ones, it's possible to manage ADHD effectively and lead a fulfilling life. If you or someone you know is affected by ADHD, there are many resources available. National organizations, local support groups, and online communities can provide information, guidance, and encouragement. Reaching out for help is a sign of strength, and connecting with others can make the journey easier. The future for individuals with ADHD is brighter than ever, thanks to ongoing research, increased awareness, and better support systems. As our understanding grows, so do the opportunities for people with ADHD to thrive. By working together, we can continue to break down barriers and create a more inclusive world. Thank you for joining us on this journey through the development of ADHD over time. Remember, ADHD is just one part of a person's story, and with the right support and understanding, individuals can achieve their goals and lead meaningful lives. Stay informed, stay connected, and keep moving forward.